Hello, welcome again to a session of surgical pathology digital slide review and sign out. I'm Dr. Louis Hassel, and our program is courtesy of the Digital Anatomic Pathology Academy, a library of many useful digital slides, which is hosted by the Digital Pathology Association in collaboration with Path Presenter. Our program also comes from the campus of the University of Oklahoma Health Sciences Center, where I am on the faculty. Our case today from the digital slide files is a 65-year-old woman who has a uterine mass that was detected when she reported for abnormal uterine bleeding. Radiographically, this mass was sort of exophytic from the fundus of the uterus, as you see here. She had some involvement, and it was of a different character in terms of imaging characteristics from the muscle or the surrounding fatty and fluid soft tissues. On resection, this is a sample image from the literature. The tumors have a fairly fleshy white appearance with a admixed vasculature and hemorrhagic areas. They may have some degenerative areas or necrosis as well in certain sites. So the digital slide that we will look at is taken from the center of this tumor and shows a very cellular tumor, which is so rich in information that it takes a little while to load all of those pixels. As you can see, at low power, it's got some vasculature here, some degenerative areas, a very pink tumor, and we will go down and look. We don't really see any architectural features here, so we're really focusing primarily on the microscopic anatomy rather than the gross anatomy in this case. The tumor margins would be of interest in many circumstances, but here we see sort of intermediate power, and you see there's some heterogeneity, some interspersed areas of larger nuclei, and some areas where we see maybe even some giant cells, for example, right there. So we'll go down and take a look at some of these areas. We can see here that there is quite a bit of nuclear pleomorphism. Look at this large cell here in contrast with other smaller cells. And on higher magnification, we see that many of these cells have prominent nucleolus, a little bit of a cherry red color. Here's another one with some sort of reddish hue to them. As we look around a bit, we see some horseshoe-shaped cells, some binucleate cells, and here we see a little mitotic figure, which is an important finding because certainly increased mitotic figures in these lesions can be a harbinger of more malignant aggressive behavior. Here we see again this area we highlighted earlier with these pleomorphic cells with very prominent bright red nucleoli. So that nucleolus is very reminiscent of melanocytic differentiation in some settings, and in this tumor that also is a consideration. Here we see that there are also multinucleate cells. That's another important feature to note. And again, we have here nearby probable mitotic figure. More high-grade nuclear atypia and various other degenerative changes. We see the cytoplasm is sort of eosinophilic, granular, variable in terms of size and distribution. And there's a delicate areas of maybe here some necrosis, some single cell apoptosis going on. So this is a good image to sort of fix into your memory as you think about this tumor. This is a tumor where we would think about stromal neoplasms, some of the sarcomas we've discussed previously. It's quite pleomorphic, but doesn't really have a smooth muscle appearance, although it could be an epithelioid smooth muscle tumor. It doesn't look like a stromal sarcoma. It doesn't look like an inflammatory myofibroblastic tumor or an undifferentiated sarcoma. It looks like it would best fit with the perivascular epithelioid cell tumors, or PEComas, of the uterus. These are stromal neoplasms of uncertain malignant potential with mixed myomelanocytic differentiation. They have some muscle and some melanocytic differential. Now, it's known that some of these can be associated with tuberous sclerosis, but that's only about 10%. As I've mentioned, the behavior can be difficult to predict, but size of the tumor, in this case, a rather bulky tumor greater than 5 centimeters, is important. Atypia, nuclear pleomorphism, multinucleate cells. Infiltrative growth is also a factor, and mitotic activity, particularly anything greater than 1 or 2 per 50 high-power fields, is considered important. And then other features such as necrosis or lymphovascular invasion. Now, immunohistochemistry can help us if we're concerned about the differential diagnosis, and we'll often want to confirm it with these stains. So melanocytic markers like HMB45, MITF, MART1, melon A, these will be positive. Although note here that S100 is usually negative. And the myocytic markers will also be positive. SMA, Desmond, Caldesmond will be positive as well. Now, one molecular marker that is sometimes applied to these is TFE3, looking for the molecular mutations that can be associated with PEComas. In fact, TFE3 fusions are not the most common finding. In fact, the most common finding is that of a TSC2 mutation, about 50% of cases. And in addition, the translocations or the fusion genes most frequently are TFE3, but other partners or other genes can also be involved with mutation. And as you see, there are variable partners for these mutations ranging from PSF1 or DVL2 to some that we don't know in each of these situations. So the molecular biology is not a single entity, as is the case in many circumstances. So our final find-out diagnosis today is PEComa of the uterus. This one has the features of a malignant PEComa, and that is important to predict behavior. It is important also to note, however, that recurrences and metastases can occur quite late in some of these cases, 10 or more years after the initial presentation. Well, I hope that's brought a few things into focus for you and painted a picture for this somewhat unusual and distinctive tumor, still relatively rare, but important to recognize because of the potential variability in behavior. I hope you'll subscribe and share your comments, or share the video with others who you think may be interested. And as always, we welcome your feedback here at our contact points. We look forward to seeing you again next time, and till then, have a wonderful day.